Hi, guys, and welcome to OSCE Talk. This is going to be our first episode on our series for students looking to get into medicine, particularly when preparing for interviews. So, interviews can be a very daunting process for people looking to apply, but we're going to try and go through as many situations and scenarios and try and help you guys prepare as much as possible. When applying for university for medicine, it's important just to look at the university and see what kind of interview they do. And you usually get that from the university's website. Most universities are MMI based. It's now deemed as more of a fair interview generally. Some unis still will use a more traditional type interview, and that's usually where you just sit down with an examiner for 20 or 30 minutes and they ask you a variety of questions. An MMI interview, that stands for multiple mini interviews. So that's when you have 6 or 7 different stations, and they each last, between 5 to 10 minutes, and you rotate around the stations. A buzzer will go off, you will read instructions, then the buzzer will go off again, you'll enter the station, you'll do that station, then the buzzer will go off, and that'll be your cue to move to the next station. It's generally deemed as more fair because it reduces examiner bias. It allows you to do worse in some stations, and you can still get an offer even if some stations go very badly, because you can just put that station behind you and move on to the next one.
And the great benefit is that none of the examiners are communicating, so you can have, an awful time and then just reset yourself, move on and get to the next station. And just to give you sort of a bit of an idea of what kind of stations exist, I'll go through some that sort of I've had or that, I've read about. So you could have role play, and that's where you'll be playing, the role of a doctor or of a patient possibly, and you might have to discuss something with someone else. So, for example, a role play could be that something as simple as a patient or a member of the public who doesn't want to get on an airplane because they're afraid of flying, and you would have to discuss that with them, trying to convince them to get on, being empathetic with them, understanding, and then whether or not they get on the plane sort of doesn't really matter, but it's just how you approach that station. Then they might think about your ethics and your judgment. Do you have good ethics? Are you able to sort of debate ethical topics? This could be something like euthanasia, which is quite big in the UK at the minute. What are your thoughts about euthanasia? Having a balanced argument and then probably coming down on one side by the end of it. They might think about your prioritization. As a doctor, you have to make a lot of decisions and you have to put things in order. You have to prioritize well. So they might ask you to have a look at a number of different tasks or scenarios. How much money should go to one area of the NHS versus another? How much should go to GPs? How much should be put into the air ambulance? How much should be put into life-saving surgery for a small number versus something else? So that'll be another type of situation where you'll just discuss through and talk through. Communication, there can be some strange communication stations. This can be things like explain to someone how to actually tie a shoelace, and you'll have to do it without actually having a shoelace in front of you, and you'll just be talking through to them. And that is, again, all about sort of being clear in terms of your communication, making sure that you don't get frustrated or angry. They'll probably intentionally not be able to do it so that you can try different ways to do it, making sure their left hand from their right hand, just breaking down that communication. And again, this is something you do every single day in medicine. Finally, then they might bring in things like your work experience, your motivation, why you want to do medicine, and having a look at your personal statement. Hopefully that should be easier because those are all things that you've experienced. And just having really good examples of actually what your experiences were, how they helped you make a decision about medicine. Did you have a great time in a GP surgery that, made you really want to, interact with patients in a GP setting? Were you in theatre and you saw the real sort of surgical side of medicine? You saw procedures being performed, things like that. So it's good to have different examples of why you're interested and not just have one or two. In terms of what medical schools are looking for, they're looking for soft skills, not just facts. They are wanting you to have a good background knowledge of sort of the GMC, different bodies, NICE guidelines, what the WHO is, the World Health Organization. And they'll also want you to have a good idea about medical ethics. So that'll be things like the 4 pillars, and then confidentiality and consent alongside that. So yeah, the 4 pillars are sort of the big ones, and those are sort of beneficence, non-maleficence, and then justice and autonomy as well. So having a good idea of those and being able to link those to some of your answers will help you sort of do well in the interviews. The NHS hot topics, myself and Peter will try and go through some of them in the coming months, but things like euthanasia are big at the minute. Junior doctors' strikes, funding for the NHS is always a big topic. Vaccination is always a big topic. There's things that have been hot topics for the last 10 to 20 years. I think other sort of common things is just you need to practice chatting to people. You need to practice communicating with people, whether that's your friends or your family. Practice in sort of 5 or 6 minutes and understanding what that feels like to talk in 5 or 6 minutes. And yeah, MMIs are something that needs to be done in a grip. So I think getting a good grip together to actually practice that, and maybe getting together people in your school who are looking to apply to medicine and practicing with them can be a really good idea.
Yeah, absolutely. We're going to try and go through as many types of situations and scenarios as possible. We're going to give examples of how to do each of these things. You'll see us acting out role plays, acting out communication skills, just to give you, an idea of what it'll be like on the day.
Yeah, and I would say the final thing is that all the stations will be different. You probably will have practiced some of them, but I'll guarantee you'll come across a station or two that you've never thought about. It is all about being thoughtful, being caring and kind, sort of talking through your thinking. Don't just sit in silence. If you don't know what to do, chat through what you're thinking and why you're thinking it. If you're nervous, they'll expect you to be nervous. They're not expecting you to be experts in anything. But just make sure you're not sitting in silence and that you're communicating well. Good eye contact, good body language, and hopefully it all goes okay.
Yeah, absolutely. As we go through each thing, so say for example when we go through the ethical debate station, they could throw up any ethical question at you and you mightn't know what to say, but it's going to be that general just talking through, explaining your process. They want to see that you're a critical thinker. They want to see your thought process. And then they want to see that you can link that back to the 4 pillars of medical ethics. And that's really all it will be. You don't actually need to know much knowledge. So you'll see that in the future episodes.